Professor Parveen Kumar, CBE. She's co-author of the world-renowned textbook Kumar and Clark's Clinical Medicine. Previously, she was Vice President of the Royal College of Physicians, President of the British Medical Association, and President of the Royal Society of Medicine. Professor Parveen Kumar.
Really rather like both Alan and Mike. I'm a massive fan of Saving Faces. It's done so much, I think, for a lot of people. And I think, as John said earlier, without our faces, it's our sort of first, anybody looks at you, they look at your face and then really derives what they think about you from that particular face. Now, I'm a gastroenterologist, so you may well be sort of arguing or saying, what the hell am I doing here? But Ian's asked me to talk about the importance of clinical research, which of course is incredibly important, and I will tell you why. Let's just start off with the doctor many years ago, and this is in the sort of late 18th century. And really all we had in those days was compassion, care and empathy and altruism. There wasn't very much we could do, but we were there for the family, and I just hope that we'll never lose that in the future as we go towards this really rather utilitarian, technology-based medicine as we seem to be going. Now, this is all very well, and you've got the microarrays, you've got the mitochondrial antibody there with all the sort of genes you can get, and all these wonderful techniques there. But how do we get there? And the answer is we can't get there without really careful research clinically. And I don't know how many of you have heard about H. pylori. Not many. Well, it's a bug. And just to tell you the story, Marshall was a surgeon who was doing a ward round and wanted to do some research. And in fact, Warren was a pathologist, and his boss, Marshall's boss, said, go and see Warren, he's a rather mad chap, he's plating gastric juices to see whether anything grows. And in fact, that's exactly what he went and did. And every day he came in every morning, looked at the plate, there was nothing there, he threw it away. But there was one day when there was a sailing cup, which in fact meant that he was away from Friday, Saturday, Sunday, Monday, Tuesday, came back on the Wednesday, looked at it, no doubt with a hangover, looked at it, threw it away, picked it up again and found there was something growing. So like a true researcher, he took a bit of made a slurry of the bug and swigged it. And this is a tricky little customer. This is Helicobacter pylori with little flagellates. But what it did was actually cause ulcers. And he almost died taking that because he got the most terrible, he endoscoped himself and looked at the stomach and it was full of erosions and so on. But remember, before this time, I had spent years looking at acid. And when somebody suddenly said that a bug could cause gastric ulcers, wow, I mean, that was a pretty big thing. We can now actually measure the bug, either taking a biopsy from the gut, or we can do it in the stools, or do a breath test. But the reason for telling you about this is that, in fact, it's a class 1, WHO class 1 carcinogen, and the risk, if you have it, of gastric cancer is many fold to what a normal population would do. And it is now probably related to all peptic ulcers, apart from those you might get by taking analgesics, which of course you shouldn't do on an empty stomach. And also a lot of people have non-ulcer dyspepsia. In other words, you've got indigestion but not related to an ulcer. A lot of them do actually also have Helicobacter pylori. But it's wanting to make a difference and trying to solve a problem, and that's called research. I couldn't think of a better quote than "the future depends on what you do today" at a launch of a brand new research centre.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organise research to improve patient treatment worldwide. Well done, Saving Faces.